Hello again. This is the 21st of August 2021, and this is not so much an naughty thoughty as a pregnancy thoughty. I'm currently 7 weeks, 2 days pregnant with my second child, and remembering why at this point in my first pregnancy I started thinking, why would anybody in their right mind have a second child? This is sort of very much a low point in terms of pregnancy symptoms. That is, the symptoms at their high point, mood at its low point. Yeah, it's not a nice time, and I want to have a little whinging event. So I thought I would do that. And hopefully somebody else might find it relatable or informative. The thing with sickness in pregnancies, it's often called morning sickness, but there is a movement to stop using the term because it's only quite a small minority of sufferers who... Cuckoo clock again. I'll try and talk over it. It's only quite a small minority. Oh, stop. Okay. It's broken. It just cuckoos whatever it likes. It's only quite a small minority of sufferers who experience it only in the morning. Studies show differing results, anything from 2% to 14% I've seen. But yeah, it's a minority, let's say, that only suffer morning sickness in the morning. The term that I prefer, I've got to say, but there are a few proposed terms. One of my favourite is NVP, nausea and vomiting in pregnancy. I think that's sort of quite accurate and descriptive. It's something that not everyone experiences. Like so many things that are female specific, it can be anything from a bit unpleasant to life-threatening. The causes and the cure is a few sort of old wives' tales and rumours and see what your mum says. Yeah, I've already got a bit fed up of being told to just eat ginger biscuits. Yeah, I mean, last time I had what's called Hyperemesis Gravidarum, which means you're just constantly being sick every day, all through your pregnancy. Yeah, well, for second and third months, it was like having constant food poisoning, honestly. It was not particularly nice. I lost a stone. At 20 weeks pregnant, I had lost a stone compared to my pre-pregnancy weight. I started off at 11 stone, went down to 10. And with, considering I had a half-formed fetus in my belly and all associated paraphernalia, that probably sort of works out as a stone and a half, just because I could not keep anything down. Yeah, it's one of those things, so many people coming up to me and, oh, don't you look lovely and slim? Oh, I blew up like a balloon when I was pregnant. How do you do it? Well, by spewing up every day. Because I get halfway through a meal and have to dash to the toilet and then just come back and finish it. That's how it got, it's just such a regular occurrence. I just didn't think anything of it anymore. I just need to dash to the toilet, back in 2 seconds. What? And there we go. I'm back. I'll finish my tea. I mean, this time round I'm kind of feeling a lot better. But it's still deeply unpleasant, let's say. In terms of actually throwing up, about twice a day or so. First thing when I stand up in the morning, I've got as long as it takes to get to the toilet before start heaving. And at that point it's kind of mostly just stomach acid, unless I've had a cup of tea in bed, and that comes up as well. And then I just have this sort of constant dull ache in my stomach all day. I can kind of keep up a gradual graze, just keep putting things in my mouth. And then sometimes I might just need to dash off again, but I can kind of hold it in until, my break at work or whenever. But yeah, it's it's been going on for a week or two now. It's probably going to go on for another month at least, and yeah, it does wear you down, You want to just kind of enjoy being pregnant and enjoy the wonder of it all, but yeah, you just keep feeling absolutely awful, and trying to keep up a reasonably healthy diet as well when everything you look at just makes you feel like being sick. It's difficult. I've got a lot of food aversions at the moment, I've got to say. Everyone sort of laughs about cravings in pregnancy. Food aversions are also a major, well, they've always been a major thing for me. I don't know about anybody else. Last time it was sausages. This time it started off with processed cheese. It's sort of moved on to most kinds of cheese now. Also some meats. And, when I'm just not feeling particularly sparkling, anything I look at does not look appetising, and I just cannot bring up the enthusiasm to put anything in my mouth. And I don't know if it is just from vomiting so much, or if it's more a pregnancy thing. I do just get this sort of constant background taste in my mouth. I don't know how to describe it really. It's sort of salty, a sort of artificial salty taste. Like over-salted frankfurters or something maybe. Not very nice. And anything I do eat is kind of tainted with that as well. It only really goes away if I eat something really strong tasting. But then, some things that are really strong tasting do sort of set me off gagging again. And I mean, the sort of constant bringing things up and gagging and sort of not feeling too good, it does take its toll on your stomach muscles, and that doesn't make it any better, and you just got this sort of constant physical ache across your stomach muscles. You can actually strain them, if you're trying hard to throw up on an empty stomach, which I'm sure I've done several times. I try and remember to relax when I stand up, but it's hard work, and it does twinge. And again, it's just one of those things that over time, it's a first world problem, it's nothing compared to the sufferings of the Afghan people or anything like that, but it just wears you down. It's just a drag, It's supposed to be a happy time. You're supposed to be celebrating and just enjoying all sorts of lovely healthy foods and things, and you can't because you just feel awful. I mentioned Hyperemesis Gravidarum words. That's when the sickness just goes on and on and on, and it's absolutely terrible. I don't know if I actually qualify for that this time, but I certainly did last time. Yeah, I've actually talked to a couple of people who said they had it really bad with their first pregnancy, but it improved with subsequent pregnancies. Which always made me wonder, but why did you have another pregnancy if you suffered so much the first time? And yeah, here I am. babies are cute, I suppose, you know. Just didn't have enough time with my first little baby, you know. They're such good parents, you know, it just seems a travesty to not have another one, I don't know. This, by the way, this is not baby. This is water retention, bloating, just general pregnancy paraphernalia, you know, all the stuff that you gather when you're pregnant. The embryo itself is 1/2 inch tops at the moment. But yeah, you do just blow up like a balloon. I mean, these jeans used to be tight on me. Look at this. These jeans used to be tight on me, and now they just, look at that. Tight on me. No, they didn't used to be tight on me. They are tight on me. They used to be loose on me. They used to be big on me. That's what I meant. Sorry, I got that wrong. They are tight on me. They used to be loose on me. That's what I mean. And that's why I'm wearing them, to be honest, because I just wear my biggest pair of jeans. But even these are a bit tight. Now you do, your body does just sort of go into overdrive, building up fat and increasing blood flow and retaining liquid, just to sort of prepare your body for the ordeal it's about to go through, to protect the uterus, to get all the nutrients and everything flowing towards what is going to be the placenta and everything like that. So yeah, you do get quite a big wobbly belly early on, though you don't actually see, the baby isn't big enough to contribute to this until second trimester, really. That's from week 13 onwards. Apparently that does, you do start to see your pregnant belly earlier if you've had a few pregnancies before, just because the muscles aren't as tight and the skin's already stretched. But yeah, your body does go through a lot of changes other than just, you know, having an embryo in it. I mean, the causes of sickness in pregnancy are, like so many female-specific things, the causes could be this, could be that, we don't know, who cares really. The cure is, I don't know, see what your mum says. Have you tried eating ginger biscuits? I don't know, maybe give that a go. Have a little walk. Maybe you're overweight, I don't know. And the symptoms can be anything from unpleasant to life-threatening. I mean, I never actually got to this point, but I have known people who have actually been in A&E on a drip because, you know, they were so ill for so long, they got dehydrated, and they just needed to get some intravenous fluids in them because, you know, it was getting to the point that it was dangerous for themselves and for their baby. I gotta say that there isn't a lot of advice I can give, other than hang in there, keep your eyes on the prize, that sort of thing, you know. This too shall pass. There's a lot of advice out there. Some of it is reasonable, some of it is complete rubbish, some of it's actually quite dangerous, you know. Even at 8 months pregnant, when I was still being sick last time, I was getting told, have you tried ginger biscuits? Yes, I have tried ginger biscuits. I have tried ginger biscuits. Yes. I still can't eat ginger biscuits. I haven't had ginger biscuits for 4 years. Yeah, and just the memory of trying to shove them into my mouth, because so many people had promised me they'd help, and then, you know, sort of hanging over the toilet with half a ginger biscuit in my mouth, and no, not helpful. So many people swear by them, though. It must have some sort of effect on a fair number of people, but no, don't put your trust in them. Same with things like aromatherapy and acupuncture and what have you. I'm not going to say don't give it a go, but at the same time, yeah, don't get your hopes up too high. Plenty of people swear by it, so, you know, maybe there's something in it, but personally I never found it any good whatsoever. The only thing that really helped me at all was antiemetic medication. Got put on some pills at about 14 weeks. They did slow it down, you know. I went from being sick sort of 4 or 5 times a day to once or twice, which was an absolute revelation, you know. I kind of felt like I'd pretty much got my life back. Could go and have a nice walk and whatever, and not have to worry about where I was going to run off and spew. But at 28 weeks, I got a call from a doctor. I went to renew the prescription. I got a call from the doctor saying, "Are you sure you still need these?" And they seemed quite suspicious as to why I kept taking them, actually. The doctors just kept getting these calls. Do you still need these? Every time I renewed the prescription, I was like, yes, that's why I renewed the prescription. Do you think I'm like an antiemetic addict, or what? Are they? Do you think I'm selling them for profit, or? Yes, I'm sure I still need these. Yeah, it's quite a trying time in a lot of ways, you know, pregnancy. I mean, it's a lot's made of the magic of growing another little person in your belly and all that kind of thing, but, you know, people come up to me and go, "Oh, are you excited? Are you happy? Are you celebrating?" Obviously, I just feel sick. It's a constant struggle. Usually, you know, the word is, I haven't experienced this myself, but plenty of people promised me that it would all go away about 12 weeks. That's when the corpus luteum, where the ovum, the ovum grows in what's called the corpus luteum, which is part of the ovary, and then the corpus luteum, after it releases the egg and the egg is fertilised, releases progesterone and estrogen to support your pregnancy until the placenta grows, and then the placenta starts taking over the job of producing the hormones. That generally happens around 10-11 weeks. And after that, as the corpus luteum diminishes and dies away, so do your less enjoyable symptoms. But yeah, that didn't work for me, as I say. I mean, it improved a bit, I'm going to say. It went from, you know, feeling like I had food poisoning to feeling like, you know, I just had a bit of a bug. But yeah, that's not necessarily the case. And then when I got to 12 weeks and I said, I'm still feeling really ill, you know, I started hearing stories about people saying, "Oh, well, yeah, I had it till 16 weeks. Yeah, I had it till 20 weeks. Oh, I had it all the way through." it's like these things aren't talked about until you're actually experiencing them yourself. And then it's actually quite surprising how many people are having the same issues or have had in the past. I do wonder if maybe there's a sort of competitive thing about it. They think of making it up for attention, and they say, oh, well, let me tell you. Possible, I don't know. And then the reflux starts. You go through the worst point of the sickness, and then you get to the reflux just as it's getting better. That's every time you lie down, because all your organs are crushed up by your expanding uterus, every time you start gagging because all the stomach contents have come up your throat. Yeah, I got through quite a lot of antacids, I've got to say. They do contain calcium, which is supposedly good. Well, actually not supposedly good, it's essential for developing your child's bones, because if you don't have enough calcium, of course, the developing fetus starts to take calcium from your own bones. Your body starts to eat itself. Which is why so many elderly women have osteoporosis. They've had a few kids and leached their bones, and now they've lost a lot of bone density. I'll talk a bit about pregnancy diet, because there's a lot of advice given about pregnancy diet, and it's constantly changing. How many servings of this and that you're supposed to have in a week, and you can't eat this kind of fish but eat lots of this sort of fish. And the thing is, as soon as you start having hyperemesis, you talk to your midwife, you say, oh, how am I going to get all my servings of fruit and veg and all my fish and meat and everything? And they say, eat whatever you can keep down. Just eat whatever stays down. So clearly it's not that vital. I remember someone I know was asking her midwife, I'm a bit confused about how many cups of tea and coffee you can have a day. Does it make a difference if it's decaf or anything like that? And the midwife just said to her, look, I've just seen a heroin addict whose baby's going to be absolutely fine. Don't worry about it. I am so very, very old that when my mum was pregnant with me, she was recommended drink Guinness. Drink lots of Guinness because it's full of iron. The thing is, it's not full of iron. It's hardly got any iron in it at all. But of course now the advice is don't drink any alcohol. I'm not really a big drinker anyway, so it's no stress for me to just say, right, okay, let's just forego alcohol for 9 months. I can do that, no trouble. But, if it's really stressing you out not having a glass of wine with your Sunday dinner or something, you're not going to kill your baby by having, 1 glass of wine with your Sunday dinner. I think the advice is no alcohol whatsoever, because it's just easier to follow than, adding up points and things. People struggle with the point system, how many points in a pint of beer, how many in a glass of wine, how many in this and that. And it is a bit confusing, and I think, just saying, right, no alcohol is, a lot easier for most people. But, yeah, and to, sort of suffer any sort of ill effects from it, to get fetal alcohol syndrome or anything, you have to be sort of drinking heavily. I mean, obviously it's different for everybody. Yeah, you have to be drinking heavily constantly. It's probably best to have none at all. Like, it's best to have lots of fruit and veg and, fresh fish and meat and no additives and all that kind of thing. But ultimately, your placenta filters all the rubbish out. Well, a fair bit of the rubbish at least. That's what it's there for. If you are really struggling to eat a decent diet because of food aversions or anything like that, your own allergies and intolerances and things, don't stress too much. Have some vitamins. You'll be okay. Keep well hydrated. Medication. Yeah, as I say, I was prescribed an antiemetic in the second trimester, which was extremely helpful. It didn't make it go away altogether, but yeah, it was very helpful. Doctors don't tend to prescribe medications in the first trimester, simply because of the whole thalidomide thing. It's just not worth the risk. A lot of medications that are described as not suitable for use by pregnant women, what they actually mean by they haven't been tested on pregnant women. And, they can't do the test because, again, it's just not worth the risk. And even things like, spot creams and things, they'll often say on the label, don't use if you're pregnant, just simply because the effects have not been measured. But yeah, the whole thalidomide issue did scare people quite a lot, I've got to say, and not without good reason. So yeah, first trimester medications, whether it's safe or not, you're not going to get them. You've just got to tough it out, really. Yeah, it's not very pleasant. It's not, doesn't make pregnancy particularly enjoyable, I've got to say. But yes, we all like lovely, cute little babies, don't we? I think I'll leave it there. Any questions, pop them in the comments. I'll see you in the next one.